Hi, I'm Meredith Harris at New Life Aesthetics, and I'm here with Paul today. Paul and I are going to be demonstrating a treatment with Botox Cosmetic by Allergan. And Botox has been around for over 15 years now. It is the most studied FDA-approved drug on the market. It is very safe, very predictable, and it's used for minimizing or correcting wrinkles. So we think about Botox being used in areas that are wrinkle prone because of movement. So if you want to think about it for cosmetic purposes, it's being used in the forehead so that when Paul lifts his brows up, you see forehead wrinkles in the horizontal plane. We may use it to correct for frown lines. So when he frowns, you'll see these, sometimes we call it the 11s or a deep valley right in the center. And then we can also use it in the area of the crow's feet. And there are additional areas that we use it, oftentimes for females, not as often for males, but to correct for the downturned corners of the mouth. So if a female just feels like she's unapproachable or looks sad all the time, where the corners of the mouth are turning down, usually that's a muscular issue where we can use Botox. And sometimes we'll use it even in the neck bands. We'll use it in the masseter muscles of the jaw to help reduce that sort of squared off or thickened area, especially for females that want a more oval or heart-shaped face. And we can use it across the bridge of the nose for little wrinkles that come in here, across the upper lip and in the chin, different places that just help to give a softer, more approachable look. So what I'm going to start with is just walking through how Botox works. We're going to be injecting it directly into the facial muscle that causes that movement, which causes the crease or the line or the fold to occur. And so in this case, I've really sort of honed in on the forehead, the frown lines, and the crow's feet for Paul. So we've treated in the past. His last treatment was about 4.5 months ago. So he's starting to see some movement come back, and that's about right in terms of time between treatments for him. Now there are some clients that don't get quite such longevity out of it, and I would say an average is 3 to 4 months between treatments. Once he's been treated, he can expect that it'll take 7 to 14 days to fully affect the muscles. So typically I'll see a new guest back about 2 weeks after treatment, and that's a good time for any little corrections or minor tweaks, little adjustments that might need to be made. So with Paul, since we've treated many times, he has what we call muscular atrophy, which is a beautiful benefit of Botox. We really want to see that these muscles soften, they relax, and they stay relaxed between treatments so that those lines really don't continue to come back. So a gentleman in his 40s that has no wrinkles, that's a wonderful, beautiful benefit of long-term use of Botox. And that's really what we go for. So if you're doing 3 to 4 treatments a year, you're probably maintaining a much softer look. And again, with a female, we might want to increase the arch of her brow. We might want to do some things that we wouldn't do for a male. So this treatment will vary slightly, but it gives you a really great idea of what any treatment could look like with Botox. So once we've reconstituted Botox, it's a liquid that we inject, and it pushes into the tissue just like water would. So it doesn't feel really like anything. There might be a minor sting. And once I've injected, you might notice that he has little welts or little product like wheals underneath the skin or mosquito bites, if you want to think of that. That is a normal side effect. It's a normal thing to expect because it's where the fluid goes into the muscle, and it takes about 20 minutes for those to go away. So once we're done filming, we're going to see that over the next 20 minutes or so, those clear up. But don't be surprised by that. He might look a little red at each site. And then once that all clears up, it's considered a lunchtime procedure. So you can go right back out to your office or out to go shopping or pick up the kids, and no one's going to know what you've done. So after treatment, the most important thing is no heavy activity initially after treatment. I really don't like my clients to lay down for at least 4 hours after treatment. That's to help prevent any side effects. You may get a headache. You can certainly treat with Motrin, ibuprofen, any of those, the drug of choice for your headaches. And I don't like you doing any heavy weightlifting, getting into jacuzzis, hot tubs, saunas, tanning beds, anything that's heat provoking the day of treatment. After you've been treated, give yourself that day, and then tomorrow you can go right back out into normal activity. and give yourself a couple weeks before you see the end result of it. So with that, what I'm going to do is just kind of mark the areas for treatment so that you can better visualize what we're going to gain from this. Get you comfortable here. All right, so Paul's totally marked and ready for his treatment, and I'm just going to go right into working in the area of the crow's feet. That's just around the eyes here, watching out for these little vessels that tend to bruise, so we'll work around those. Little pinch here, Paul. Maybe a slight stinging sensation, and like I said earlier, it's not uncommon to see a little mosquito bite type of appearance. The dosing of Botox is very customized and very much individualized. So the more movement that we have there, the more it demands product. Because Paul doesn't have a lot of movement, he doesn't need a lot of product. So I've already given Paul his post-treatment instructions. He knows what to expect. Give it 20 minutes or so. These little bumps will be gone. Slightly red on the areas, but that goes away very quickly. And apparently very comfortable. All right. Thank you so much for joining us at New Life Aesthetics.